Late Night Health continues, hour 2, and Joanne Halbrecht, who visited with us last year, we talked to her about the spine and about wearing a special jacket that kept you straight. Well, we're going to talk with Joanne now about new technology for, I guess, knees and hips. Dr. Halbrecht, I'm going to call you Joanne. We're friends. Joanne, welcome back to Late Night Health. Does that
Thank
mean
you, Mark.
that we don't have to be creaky and crunchy anymore with our knees and shoulders and hips?
Well, it depends on what creaky and crunchy is. If we're talking about the creaking and crunching that gives you pain, we're looking at things like osteoarthritis. And osteoarthritis is the breakdown of cartilage.
And that's a very common thing in people, say, 40 plus?
Yes, very common, significant percentage of our population has osteoarthritis, which can be very painful. Typically, symptoms of arthritis are morning stiffness in the knees or shoulders or hips, and then as you get going, it tends to feel better, but then if you're more active, you have increased pain, and sometimes that's accompanied by swelling.
What causes osteoarthritis? Is that just a natural aging process?
You know, it's more, I have patients in their 80s who have no osteoarthritis, but it's more common to have osteoarthritis as we age than not to. And we tend to see osteoarthritis as a result of genetics. So mom, dad, grandma, grandpa, you know, they may have had symptoms of osteoarthritis. The fingers where you see they have the big joints that don't look quite normal, or maybe someone in the family has had a total knee or a total hip replacement. So that's really the strongest factor is genetics. Then we look at trauma. So
Before we talk about trauma, what about epigenetics? We've been talking about this lately, that just because your genetics says you're going to have, say, heart disease or osteoarthritis, there are things you can do to either slow it down, prevent it.
Yes. Yes, so in terms of the osteoarthritis, we can slow that process down if we're not doing excessive weight-bearing activities, pounding on our joints. Then our joints will have a longer life, even if we're predisposed to have arthritis, as well as watching our weight. So we know reliably we've had a significant increase in the incidence of knee replacements because of the obesity epidemic in the United States. So loading the joints with excess weight, every 10 pounds that you gain above the waist puts another 75 to 100 pounds across the knee. So loading that knee joint with either doing impact activity or obesity can accelerate that arthritic process.
So that means that Daryl and I should no longer do our 25-mile runs every day.
That might not be the best thing for your knee, but I have patients who, they do that, their knees are fine, but more often you see as people get older, they start to have problems.
What would older be? I'm putting that in quotes.
Well, I would say I start to see more problems with people in their 50s who have been long-time runners.
And there are other exercises, low impact, that they can do. Things like, I guess, swimming is easier on the knees and other joints. The stationary bike, even biking.
Yes, so for me, I typically say anything on wheels or water, easier on your joints.
Yeah, but you live in Colorado, so skiing is big.
Yes.
Right? Do you ski?
Absolutely.
Absolutely, she says. Knowing that that's high impact on your knees, you can't
But
work
you're
on
skiing
your
on a
knee?
frictionless surface.
I'm sorry?
So you're skiing on frozen water.
Right.
And you have the skis, which are hopefully nicely waxed, so you don't have a significant amount of friction there. And what really is going to load the knee more with skiing are doing bumps. So I'll say to my patients who have arthritis, they'll say, so doc, can I go skiing with the knees like this? And I say, well, it depends on how you define a fun day of skiing. Is that just going down groomers, or is it hitting the bumps?
My father-in-law, who is turning 92 as we record this show, I think would love to go skiing again. It's been about 10 years. He was 81, And, of course, the story goes that he was coming up on 65 and couldn't wait to go skiing because at 65 you got a free lift ticket. He got up there and they changed it to 70, then 75, and finally he got his free lift ticket at 80, and who knows what it is now. But he enjoyed the sport. Should somebody like him, whose bones are probably brittle because he's 92, should he give it up because of that?
I think that if you're in reasonably good shape, and particularly for skiing, we need some good core strength and some good lower extremity strength. If he's in a fitness program, the skis that they have out now make it so much. The shape skis make it so much easier to turn the skis, and it makes it much easier for someone to ski as they get older because there's a lot less energy expenditure and force that's needed to turn the skis. And again, if we're going on nice groomed terrain, then that might be something that's reasonable for him.
I think he liked to jump. That's he invited me to go skiing and has for years. His other son-in-laws both broke legs, and I decided not to go with him. Let's talk about the latest technology in helping to reduce the osteoarthritis in, say, knees and other joints, and that is stem cell use. That's one. And then we have to sneak in your background, the fact that you're an engineer as well as a doctor.
Yes.
Amazing. So,
well, it was a natural transition. I originally wanted to be a bioengineer, but didn't want to be in a lab all day long. So I really like the patient interaction, and I can really apply a lot of the skills that I've learned in my undergraduate degree in engineering to orthopedics and biomechanics and biomaterials.
Wow. So stem cells, very much in the news. Can you rebuild my knee?
So it depends on how significant the arthritic process is in the knee. And to go back, as an engineer, I was into biomechanics, but the more I learned in terms of the new studies coming out with biologics, because biologics are really the future of medicine, the more excited I got about doing stem cell therapy. Because certainly I can't talk to a patient and say, I may be able to rejuvenate your knee and regenerate cartilage with stem cell therapy when only studies are out that have been done on animals. And so studies came out in the last few years, human studies showing really fabulous results, regenerating meniscus, regenerating cartilage on the surface of the bone, that articular cartilage that gets worn away or degrades with osteoarthritis, as well as increasing the success of surgical procedures such as rotator cuff repair. So when we inject stem cells, and I get stem cells from fat because there are more stem cells in fat than in bone marrow, and the more stem cells, the better the response.
So you get you take, if you're working on my knee,
yes,
or Daryl's knee, it's my
yes,
fat and Daryl's fat.
Yes. And so you have to, the FDA mandates that we have to take it from you and reimplant it in you. We can't use it on someone else. We can't take it to a lab and do something with it. So it's done in the same setting. And studies have shown that when we take the fat out, and the fat contains different growth factors as well as stem cells, and we inject it into your arthritic joint, the stem cells will signal the cells in the area, the dormant stem cells in your cartilage, to proliferate and grow. And so a lot of people have the misperception that stem cells will differentiate in the body, and they differentiate in the lab, but they do not do that in the body. In the body, they're like little drugstores. And so not only are they capable of signaling your dormant stem cells, but they're also powerful anti-inflammatories, so much more powerful than a steroid injection. They also inhibit scar tissue formation. They promote the growth of blood vessels, and they're also antibacterial.
So, wow.
Yeah, they're amazing.
Yeah, they are. And obviously studies are going on constantly about this. I think you have an associate here in the Southern California area who's a leading practitioner in this.
Yes. He did a study Dr. Vangsness did a study at USC where they had patients with meniscus tears, and they needed surgery. They got stem cells, and this was an FDA-approved study, stem cells that were from other people. So, again, you can't use them. I couldn't use it in my practice unless I were doing an FDA study. But they had stem cells from other people, injected them in the knee in what's called a double-blind study. So the patient doctor didn't know what they were given. They had controls. And they looked at whether the patients regrew meniscus after surgery. And a certain percentage of the people who had the stem cell injection regrew more than 15% of the meniscus, which prior to that study was unheard of.
And what about the percentage of people who grew that?
So their symptoms improved significantly, and the purpose of the meniscus is to serve as a shock absorber inside the knee,
right,
and to prevent you from getting arthritis or prevent arthritis from becoming worse. So if we can regrow meniscus, we can potentially prevent you from having arthritis in the knee in the future.
And what we're going to do is when we take our break, we're going to talk about bone on bone, if that's too late, and things like that. Joanne Halbrecht is our guest. I'm Mark Alyn, along with the insane Daryl Wayne. We're spending the day together again, aren't we, Daryl?
Oh, very much so.
Long day together. He'll be tired of me, boy. Join us at latenighthealth.com, latenighthealth.com. More coming up. Don't go away.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate a lower tax bill. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will fight for you using industry secrets that can stop any IRS actions, eliminate penalties and interest, and reduce your past tax bill so you pay the IRS less. If you owe $10,000 or more in back taxes, call the Tax Doctor now for a free IRS audit emergency review.
800-663-5107. 800-663-5107. 800-663-5107. That's 800-663-5107.